Indeed, it's an honor to be and a great privilege to be here this morning for the official opening and of this very important primary healthcare symposium. Ladies and gentlemen, the work that you do in primary healthcare is very vital to our nation. And of course, primary healthcare, as you know, is the heart of any effective health system. We also know that primary healthcare can improve deprived communities' access to health services, and that primary healthcare supports prevention and early intervention to tackle the various health problems that we continue to have. And on the other hand, you also know that primary healthcare can reduce unnecessary use of costly services and help prevent overprescribing of antibiotics. And of course, primary healthcare can keep people well and out of our hospitals, which is the biggest challenge that we have. Ladies and gentlemen, your discussions over the course of this symposium can help us to continue our efforts to strengthen Fiji's primary healthcare services and to build on the country's wellness agenda. Central to that wellness agenda is tackling the growing epidemic of non-communicable diseases in our communities today. NCDs, I don't have to remind it, but at this forum, I think it's important to say, NCDs such as obesity, cardiovascular diseases, heart attacks and stroke, cancers, diabetes, chronic respiratory diseases are a large and a growing problem for our country. They contribute to about 80% of deaths among those aged below 70 years. Quite an alarming statistics. The World Health Organization reports that Fiji has the second highest rate of NCD-related deaths in the Pacific. Again, very alarming for our people. Of course, there are four main contributors of NCDs that we need to understand, and very simple: unhealthy eating habits, overuse and abuse of alcohol, lack of physical exercise, and smoking. Our focus on wellness seeks to address risk factors in all these areas. But I'm sure, as I know and you all know, that the health sector cannot tackle this task alone. We know that individuals' and populations' health outcomes are influenced by complex mix of individual characteristics, lifestyle choices, and the physical, social, and economic environments in which people live, play, study, and work. Health outcomes are also shaped by economic factors such as housing conditions, by levels of education, and increasingly by the impacts of climate change. I'm sure you will be considering all of these and other issues during this very important symposium. Just last week, I had the privilege to travel to Oahu with the Regional Director of the World Health Organization, Dr. Shin, where we recognized Levuka as the first tobacco-free World Heritage Site and declared the community hall in Bureta village as the latest addition to Fiji's roll call of tobacco-free halls. On both these occasions, I commended that putting up signs and making declarations has obvious symbolic value, but I also commented that the real change in abandoning tobacco and addressing other lifestyle factors needs to come from individuals themselves. And that is one message as a ministry we need to continuously put it out to the public. Each individual is responsible for his or own health. Governments and the hard-working team in all our wellness centers can only do so much. We can and we should focus our efforts on making healthy choices easy choices. We can and should use legislations where necessary to limit access to harmful products such as tobacco. But we can only go so far, and ultimately we need individuals and families to step up and take responsibility for their own health and well-being. While I was talking to the dedicated nursing team in Bureta Village Health Center last week, I asked about the extent of diabetes in the community and how well controlled it was. I was impressed by our nurses' knowledge of how many people were living with diabetes there and the efforts they made to identify and educate those who were at a risk of becoming diabetic. But I was also greatly disturbed to learn, like my PS, I was greatly disturbed to learn that many people who had diabetes chose not to take medications that could so easily manage and control the illness. Why is that? We can question, why is that? People who choose not to take essential medicines when the government provides them free of charge. Why are some people willing to allow their health to gradually deteriorate and condemn themselves to shorter lives, to a life that is possibly beset by discomfort and disability, and in doing so, create additional burdens for our health services as well as their families and their communities? We need to ask these questions why and how we can address that. And I'm sure in your symposium, you will shed a little bit of light as to how, again, we can get these individuals to seek assistance so that they do not condemn themselves to these diseases. We can help, as the nurses of Bureta do, but we need to work in partnership with patients and the wider community. And we need you, the wellness experts, to provide us with that knowledge and understanding to make healthy choices, easy choices for our people. As a minister, I face frequent demands for government to fund dialysis services for people suffering kidney failure because of dialysis. The arguments presented are compelling, but I question whether spending hundreds of thousands of dollars on public-funded dialysis is the best way for our country to go. In 2010 and 2011, it was estimated, on average, providing dialysis for patients with diabetes-related kidney failure cost the government of Samoa around $70,000 per patient per year. And you all know that dialysis is not just for 1 year. It is a continuous treatment. So the decisions that we make for our people has to be the right decisions. Even if we could reduce the cost of half that amount here in Fiji, it would still be a significant drain on our nation's resources and would divert funding from other essential prevention and treatment programs. That's where we should be focusing on, prevention and treatment programs. Again, we come back, individual choices. Where do individuals want to head in future in terms of NCDs? How can we deter them from heading in the wrong direction? How can we assist them to make the right choice when it comes to the health of themselves and their families? What is more, ladies and gentlemen, I often hear dialysis described as a life-saving treatment. The sad news is it is not. It is not a life-saving treatment. The same study in Samoa found that almost 1/3 of the patients undergoing dialysis died within a year of starting dialysis, and almost 2/3 have died within 2 years. So is dialysis really a life-saving treatment? Another study of Cook Islanders who received dialysis in New Zealand found that half died within 4 years of starting the treatment. So again, is it a life-saving treatment? So basically what we can say, the key to tackling diabetes challenge is early intervention, or any NCD is early intervention and better compliance with effective treatment. Those are things that good primary health care can do. And as experts, we will rely on your judgment on this. Okay. I have focused on diabetes, but we know that every day we have patients who suffer needlessly because they have not received the primary and preventive health services they need, and we are well equipped to deliver. So over the next 2 days, you will have the opportunity to discuss and debate what works well in our wellness sector and where there is a scope for improvement. You will hear about the research that your colleagues have undertaken, much of it practical research based on real-world experiences at the sharp end of the service delivery here in Fiji. The quality and quantity of that research is a credit to all who work in our wellness sector. I therefore encourage you to be rigorous in your analysis and vigorous in your debates. I know that many of you will see this symposium as a forum to explore opportunities for publishing your work. I also recognize the value of doing so, and I appreciate that publication is a clear sign of esteem in which our researchers and clinicians are held by their peers. So I congratulate all those who have received such recognitions. For me, however, the key measure of success for a symposium such as this is the emergence of robust practical proposals that the Ministry of Health can adopt to deliver better service outcomes for our Fijians. So I look forward to learning of such proposals in the weeks and months ahead. And on that note, ladies and gentlemen, I thank you once again for giving me the opportunity to be here at this auspicious event. I hope it is one of intellectually stimulating and professionally rewarding for you all, and that together we can contribute to build a health system and a nation where wellness is at the heart of everything that we do. So finally, once again, please allow me to congratulate you and thank you for the hard work that you do in ensuring that we deliver the best and only the best to our Fijian people. I must also remind you that the Ministry's stand in service delivery remains. Service delivery and care to the patients that come to us should be of utmost priority to all of us in this field. Okay? And finally, to all the mothers here, I know it's Mother's Day next week. Many at times as civil servants, as mothers, as wives, a lot of challenges that you face, and many a times you are not thanked enough for that. Please allow me to thank you for all the hard work that you do for the ministry, for the nation, and allow me to wish you a very, very blessed Mother's Day to all the mothers here, and hope you have a wonderful Sunday with your family next week. To the gentlemen present in the room, it's your honors to make Sunday a blessed one for our ladies. So thank you very much, and enjoy the day. Thank you.